Hello, everybody. Today's tidbit will be talking about caring for a child with the flu. It is the time of year that it is flu season, and with everything that is going on, I thought that it would be a good topic to talk about so that we have it fresh in our minds and just so that we have material to look back on if needed. I can understand if we're kind of sick about hearing about sickness, but it's good to just have on hand. What are some symptoms of the flu? Flu symptoms usually appear suddenly and can include cough and fever, sore throat, muscle aches, joint pain, and fatigue. Young children may not always have a fever and may feel sick to their stomach, vomit, or have diarrhea. Not everybody who has the flu develops symptoms, but they may be able to spread it to others, especially if it's through cough or a sneeze. And it's important to help children to practice their good cough and sneeze etiquette. So I know that that can become difficult, especially with young ones that just don't quite understand how to kind of keep this stuff to themselves. But one thing that kind of stood out in my mind is that a daycare provider of ours that took care of our daughter, she used to tell the kids to cough in their cough spot. So that would be on the inside of the elbow. And they just received it really well. So there's a good little tip for you. How do I know if a child has a fever? So fever is a sign that the body is fighting an infection or an illness. A child has a fever in the body if the temperature is higher than 38 Celsius or 100.4 Fahrenheit. Touching a forehead or the neck is not a reliable way to check if somebody has a fever, and that the best way to measure a child's temperature is by buying a digital thermometer. For infants and young children, the safest way to take the temperature is in the center of the armpit. If the child is over 2 years of age, one of those ear thermometers can be used. And taking the temperature in the mouth is unsafe, just because you have to think that young children, they can bite and they can break the thermometer. A lot of thermometers now are starting to get soft and stuff like that for that reason. But it is more accurate and easier to try and get it through the center of the armpit. And also the reading can also become wrong, and it's harder to keep under the child's tongue. So just a warning here, you do not take the temperature in the rectum, so the bum of the child. This is an old practice, and they're no longer recommending this for that it can be dangerous and obviously upsetting for the child, right? So now officially we're just trying to avoid that. What can I do at home to treat a child's fever? So you want to dress the child in lightweight clothing and keep the room temperature around 20. Do not take off your child's clothes because they may become too cold and start to shiver. And shivering produces more body heat actually, and it can cause the temperature to rise again, believe it or not. I know that's kind of like a natural thing that we want to kind of do for them. So also remove extra blankets so that heat can leave the child's body. This helps to lower the body temperature. And it's nice to just you can cover them with a sheet just because, like, once again, it's lightweight and it's perfect. Offer plenty of fluids, so such as water or watered down juice. If your child is breastfeeding or on formula, offer more frequent milk feeding opportunities. And saying that too, if you are breastfeeding, make sure that you keep yourself really hydrated as well, because if baby's on you a little bit more, it's good to make sure that you're hydrated as well. You want to offer small but nutritious meals. Many children with a fever will not feel hungry though, but it's good to present it to them and get something in their tummy. So acetaminophen which would be your Tylenol or the Tempra, is the best drug for lowering fever in children. The dose and the form of medications, so drops, chewable tablets, depends on your child's weight and age. So you want to make sure that you're reading product labels carefully for ingredients, also for dosage and frequency of how often you would be able to give it to them, or consult with your healthcare professional as well. So just note here that ibuprofen, for example, like your Advil or your Motrin, it may be also used for children, but just to please keep in mind that it's for children older than 6 months. So please do not give ibuprofen under 6 months of age, but Tylenol is okay. And another warning here, so please do not give ACA, which is also aspirin, to anyone. So no aspirin for anybody under 18 years of age because it can lead to brain damage or even liver damage. So no aspirin. How can I treat other flu symptoms? So make sure that your child gets plenty of rest. I know that sometimes that's easier said than done, but rest is the best thing for sure. Use a cool mist humidifier to help with the stuffy nose. If a baby is having problem breathing because of a stuffy nose, you can try using the saline drops or the spray to help the mucus. This will help clear the nose, but however, please keep in mind that those suction bulbs should be used very sparingly. So much so that you don't want to use them any more than 3 times a day. So you really want to use it as little as possible. So here is a really important question that it's always on our mind when we have a child kind of dipping back and forth with a mild to high fever is when should I seek medical care for my child? Many children with the flu have a fever. The degrees of the fever does not tell you how serious your child's illness is. How a child acts is usually a better sign. A child with a mild infection can easily have a high fever, while a child with a severe infection may have no fever at all. If your child is under 5 and has flu symptoms, you should contact your health provider. It is especially important that you contact a healthcare provider or take your child to an emergency department if your child has signs of the flu, but also has the following. So if they have lung or heart disease, has an illness or taking treatment that affects the immune system, has a fever for more than 72 hours, is excessively cranky, fussy, or irritable, is not interested in playing with toys, or is unusually sleepy, listless, or not responding, has trouble breathing when resting, is wheezing, and has chest pain, has vomited for more than 4 hours and has severe diarrhea, because then you are concerned about dehydration, has a fever with a rash, and not feeling better within 5 days, or was better and then developed a new fever. And here is a list of when you want to take your child immediately to the hospital emergency department or when it is time to call 911. Your child has a fever and is under 3 months of age, drinks very little liquid, and has not peed at least once every 6 hours when awake. has severe trouble breathing or blue lips, is limp or unable to move, is hard to wake up or does not respond, has a stiff neck, seems confused, or has a seizure, which is like a convulsion. Uh, so if any of the following happens, please take your child immediately to the hospital, to the emergency department, or call 911 as soon as possible. Most of all, guys, we want you to stay safe. It's definitely something that we have to take seriously all the time, but especially now more than ever. You need to be able to take care of yourself so that you can take care of your family. You can do that by staying home when you can. Maintaining a healthy, balanced diet will go a longer way than you would think. You want to drink lots of water, stay hydrated, be active, and get enough rest and sleep. So I know that that's kind of a tough one, especially if you have a new babe. Sleep isn't always the first thing that you're getting. So you want to sleep when baby's sleeping. Um, but most of all, you really need to keep in mind that you need to take care of you so that you can take care of others. Um, so thank you. I hope that you enjoyed that you learned something new. Definitely take a look below. I will be adding some links to different resources, and you guys take care, and we'll talk